can you just explain to us, like, in the process before, if you're helping moms that are struggling with fertility, how you get them to a
Okay.
place in their life where where they're able to conceive and have a baby?
Yeah. Okay. So, what I say with acupuncture, it's a big conversation. It's grown outside of the fertility field. Is that fertility is a symptom, and the root cause is some disruption of how the brain communicates with the reproductive organs. And I think that's where mental health really comes in, because a lot of people will come, especially in fertility, they'll say, "Oh, it's in your head," and I think that's dismissive. It's not in your head; it's in your brain, and it's a complex cascade of brain chemistry. One being the cortisol release, the stress, right? So, for the backtrack, the statement that we say about acupuncture, women's health here is that menarche to menopause. We cover all aspects of women's health, prepartum, postpartum, fertility. One of the things we see is young women with difficult periods were put on the pill at a very young age, and then they become, when they're ready to have to get pregnant, it throws off the whole process. So right there is something that we can help with. If you have what they call PMDD or dysmenorrhea, these are things that we can help with very easily with acupuncture. So down the road, if you've been on the pill for so long, you're having trouble getting pregnant, there's a lot of disappointment, failure, isolation, the lack of intimacy, getting back to the chemical cascade. Intimacy is a big part of it. The release of oxytocin, opening up how the brain communicates with the reproductive organs, is literally taking away from the patient because you're told you're too old, your eggs are bad, you're running out of time. Your mother-in-law and the bitch at the baby shower. I'm not trying to be funny, but this is what I hear from patients, right? This is the reality of it. And that creates stress, and then it releases cortisol, and it blocks how the brain communicates with the reproductive organs, and it creates a whole fertility thing. Now, to get to the root of it, this is where we can partner, especially with mental health. I always ask the patient, are you working with a therapist? Do you have somebody to talk to about this? We are not psychologists. We have done, to your surprise, some clinical counseling in our training, but not enough to really do what you guys do. But it is enough to at least acknowledge, listen, and get the patient right kind of care. And why that matters, let's get this out of the way right now. What's very, very important in any patient in this practice, especially with what we call, or what has been called, generalized anxiety and depression, the first thing I ask, is there a history of trauma? And that's trauma with a capital T, because if there isn't, fine. Then you're talking about a hormonal imbalance. So for the patient who has PMDD, or the woman who has anxiety from menopause, it is the withdrawal from estrogen and the surge of progesterone creates havoc. Now, having had some sort of trauma that has been resolved or addressed in the past, that's going to make things worse. So I don't want to be in a situation where I'm treating symptoms of anxiety and depression. I want to get to the root cause, and to get to the root is what you guys do. So to sum up, in the case of women's health and mental health, yes, it can be hormonal, but it can also be a product of some sort of unresolved trauma that definitely needs to be addressed. And then we'll get, oh, I tried it, it didn't work. I said, you didn't find the right therapist. We need to find you the right therapist. So having resources to help patients is very important, especially for that. So trauma is very, very important to address in all aspects of it.
I really appreciate, there's so many layers of what you said there, and so many of them we address in therapy. And it's a process, right? And I think that that's part of what goes on, is this notion with fertility that it's this chemical thing and I can just fix it. But you're absolutely correct. Like, kind of like peeling back the layers on the onion, if there's trauma involved, there's a lot of not only societal expectations, familial expectations, personal expectations, and how that kind of shows up and stores in your body in a way that it spikes that cortisol. It doesn't give you the ability to kind of, even engaging in acupuncture, if they may not receive the full benefits of it, if they're not really there at a mental level or capacity. Really good.
Absolutely. Yes. 100% agree on it.
Yeah, so we just wanted to kind of intertwine Elizabeth's services as a resource, because, like you're saying, mothers need different layers of support to get to where they need to be to feel the way they want to and able to have a baby if they want to. So Elizabeth is offering pro bono sessions, so for moms who may not be insured or can afford mental health therapy, as well as a free mom support group where moms can come together and talk through their problems and connect and create a community which can support them in all areas of their health.
Yeah. So I think this notion, and I'm sure that you see it a lot in your practice, this notion of community and kind of lack thereof it, especially during those like prenatal and postnatal and all the various phases of womanhood, right? Like you talked about menopause and all the transitions that kind of happen within the female body biologically, but there's so many things that happen as well during that time for women, whether they be empty nesting, whether they be career changing, whether they be, financial constraints or what have you. And that's another component of therapy that can be so powerful, but specifically to moms, new moms, and even veteran moms, that sense of community within a group of people that are non-judgmental. It's really hard to find that, right? Like a lot of moms, they're not, they're not necessarily always talked about with social media the way adolescents are. Like we hear so much buzz around how social media is changing kids and they're online all the time and all this phone and media usage. But it's the same thing for moms, right? They're online. They have these expectations that they may be getting driven from themselves, but also reinforced through social media that may not necessarily be realistic. And that's kind of what the support group is about, is coming to a place where it's real, right? Motherhood is hard. It's challenging. It's draining. It takes a tremendous amount, not only out of the individual, but out of the family unit, out of the marriage. And there's a lot of this like stigma behind coming to therapy or coming to a support group that you need to be in crisis to go. And it's really not what it's about. It's really about kind of like creating the tools ahead of time, learning, how to regulate your children, how to regulate yourself, and identifying, coping skills and tools to be able to assist you to generally make your life better. So,
Yeah. I mean, as an adult, right? Like, what was the consensus for the longest time was just to kind of like, well, you're an adult now, get over it, move on. You have bigger things, more important things. And I think that's just the reality of life. We focus on children; they need all the resources. Yeah, with moms, especially new moms, what people don't realize is that we are all familiar with emotional stress, correct? But there's also physical and chemical stress too, right? So a screaming baby will, disrupt how we release prolactin, and it might interfere with breastfeeding. And then when we're not able to breastfeed, we start to kind of stress out about that. So another layer of the emotional stress. You just delivered. It's a physically demanding. You've lost a ton of blood. That's something that needs to be acknowledged. So for us, what I like to do is, again, acknowledge the trauma piece and get them the right kind of help. But there's nothing wrong with just a physical intervention, right? That whole thing of just the cortisol release, the acupuncture releases endorphins and it directly cuts. That's how it regulates a lot of this. How fertility, that's like a big linchpin. Like regulating the cycle, getting on a 28-day for peak fertility is really what gets the patient successful, whether naturally or with IVF. For a new mom, right, sometimes you just need a break. Maybe you don't need to address the heavy burden of working through a therapy session. Or once you have and you're feeling a little drained, you can reach out for that, taking the edge off, or you can do it before so that your session can be better. We've worked with people who are going through mental health sessions with their practitioners, and we can either make it easier for them or be there to help clean up after. But sometimes you just need to feel a little. I mean, you can't. Like people can say, do yoga, do meditation, do all these things. That's hard to do when you're fighting a bear, right? People don't really understand the physiology of stress and how it impacts the body. When you are stressed out, you are not going to meditate, right? It's gonna be hard to do that. You're incapable of critical thought. The whole testing paradigm falls behind that. What do you do if you're not prepared for a test? You're stressing out. You're not taking the test. You're failing. You're not getting blood to the brain to help you kind of rationalize these things. So how do you expect it to handle a child or handle your session? There are these options where acupuncture can kind of step in and just make you feel a little bit better so that you can reprocess your thoughts or come through a session or be ready for a session. So we do offer that. We also offer herbs. We do herbal medicine. So what I say is that they're sedating. They're not hypnotic. They're not you can operate heavy machinery. You're just going to take the edge off. There are options out there. And sometimes there's a need for medication too, but medication is a bridge, not a destination. And a lot of the work here, having worked in substance abuse, in detox, I've made a career of trying to help people get off Xanax, and things like that. But I think to speak to that sort of like moms needing help, there is help, but I think society puts a burden on like you're just supposed to kind of plow through and make sure your kids are okay or off the social media or not in harm's way, and then you come second or third or fourth or fifth.
Right. And I really like a couple things about what you said really resonated with me is that notion of like emotional regulation, right? That's what I'm taking away from that. It's just like the ability to regulate your emotions or learn the skills so that when you're in that heightened response and you're unable to cope with what needs to be coped with. And you're absolutely right. That's not the time that you're going to pull out your mat and get into a Zen position and start doing yoga. It's too late by then, right?
Mm-hmm.
So a lot of it is like preventative, learning the skills and the tools in a way that you can practically use them. But some of it too is also just, validating and removing some of the stigma behind it's okay. Like you're not going to be perfect, right? And where it kind of like into those notions of where that perfectionism comes from and how it shows up. But I love that idea of kind of like helping co-regulate, before sessions or after sessions and talking about like the trauma and the source behind that and how to kind of address that in a way that's productive for moms. I think trauma is such a big buzzword right now. It's such a sensitive term. It shows up for everybody differently at different points in their life. I mean, just becoming a mom is traumatic in some way.
Yeah, absolutely. Speaking to the yoga piece, maybe you don't sit in a room quietly and meditate, but I think in order to kind of, what you're saying is that acknowledge and contain, acknowledge the anxiety and implement. I think physical anchors like yoga can be helpful. Maybe it's a little passive, but long brisk walks. I'm a big fan of the martial arts, Tai Chi, more internal stuff, breathing and movement together. Being able to get out of your head and channel that energy whilst breathing, like whilst meditating doesn't have to be sitting in a dark room. Guess what, right? There's no wrong or right way to meditate. The hard part is shutting the chatter off, like overcoming the badgering of the thoughts and the processing of those old emotions and stuff like that. But yes, sometimes you got to bounce a basketball or burn it off. You got to burn it off. You got to find a way to just kind of vent that and then kind of come back to it. But the worst thing is to be, and this is why we have things like acupuncture, mental health. Sometimes we're just trapped in it and we still, and it doesn't move forward. And that's the worst part of it. The worst thing is not to be able to have success for your patient, right? So that's why it's important to have these resources, sending them to the right place or the right person to say the right thing to help them. That is critical. Dealing with adverse childhood experience or violent crime, acts of violence and stuff like that, the worst thing is to have that person working in detox. I realized that nobody wakes up one day and decides to be a drug addict. It's a long road, and the worst thing for that person is to kind of like spiral and be in harm's way, possibly overdosing or subjecting to self-medication. And the win there is to get them the right resources for them to kind of get out of that situation. And I'm not even saying it's acupuncture, but I do believe it does have a lot to do with counseling. So we're really big on helping our patients get to the right kind of care, acknowledging it first and getting them, whether they want to or not. Oh, I tried, it didn't work. No, that's not an option here. We need to find the right person, for that.
I appreciate how much I'm hearing you say about psychoeducation for your clients, because I think it's so important especially for women. Like, it's so empowering, like knowing what's going on versus like guessing or thinking what's going on. And I think that's such a powerful tool as far as resources. I mean, that's a huge part of it.
Yeah, I just had a question really quickly. For people that don't know a lot about acupuncture and how it works, I know we're talking about how trauma is physically taxing on your body. So like when someone is unpacking trauma, say with a therapist or in a support group, how are you, like, walk us through a little bit how the acupuncture works, where you're targeting in their body, and how that helps to aid them in releasing that trauma?
Right. So as we said, I don't get a lot of moms because they have bigger responsibilities. And as we said, one of the problems is self-care is not selfish. They don't want to hear it, right? They have a baby. So for us, it's about getting a patient to become a mom, right? And that's a long road. So in the realm of women's health, fertility, or irregular cycles and painful menstruation, acupuncture has three basic effects. Locally, we're increasing circulation to an area. So to apply to something like a back muscle that's not working properly, that creates pain, we want to use the analogy of like a cut. When you cut yourself, you don't bleed out and die. The body has the ability to handle and manage it. So we are hijacking that body's ability to heal itself and sending it directly to the area. In the case of a fertility patient, we are sending it to an ovary, we're sending it to a uterus for better ovulation, better quality of eggs, and better implantation to get to where they need to be, IVF, natural, whatever. Now, that signal locally, there is a little bit more on the physical end when we're treating back pain and muscle issues. There is a high level skill of getting the muscle to kind of like stop firing and relax. That signal travels up the nerve pathway. And when you cut your finger, you shake it. Why? Because the actual physical motion overrides the immediate pain signal. So like that, we can shut the pain signal in the nerve pathway. It's called the gate theory, or the diffuse noxious inhibitory controls. Your body has the ability to modulate pain. So think of that cut you have, maybe you have one now, or you had one in the past. It doesn't hurt all the time. It only kind of hurts when you poke on it. The body has the ability to shut that actual pain signal down. And then finally, when it gets to the brain, it releases endorphins. And endorphins are really good at further managing pain. But endorphins, actually, in the case of fertility, open up how the brain communicates with the reproductive organs. When you cut the cortisol, the brain can release gonadotrophic hormone, which tells the pituitary gland to tell the ovaries what to do. Now, you see, that's a lot, right, to unpack. There's a lot of chemistry there, the chemistry in the brain. But simply, acupuncture has the ability to cut cortisol and allow the patient to stop fighting the bear and go into parasympathetic, where we can regulate autonomic function so that we're not fighting the bear all the time. And sometimes you just need to give it some time. Breathing, expanding the chest cavity, in taking in. What do they tell somebody who's in a panic attack, right? Just breathe. Why? It's not dismissive. Yes, to some degree, it's a distraction. But the fact is, when you take in more oxygen, your heart doesn't have to work as much, right? When you expand the diaphragm, you stimulate the vagus nerve and you put the patient into sympathetic. That's part of it. And when you combine that with an endorphin release, you create an environment where all these things can open up. So whether you're talking about digestive issues, or you're talking about, mental illness impacting digestion, mental illness impacting heart rate, mental illness impacting your cycle, mental illness impacting physical pain, like, the tension and creating that neck pain, the stress headache, right? So that's how acupuncture works. That's how it works for women's health, and that's how it works for aches and pains. That's what we do here. But specifically, the one thing to take away here for mental illness or generalized anxiety and depression is that endorphins cut the cortisol. So if you're being triggered or you're stressed out all the time, we say in Chinese medicine that the inability to express anger leads to frustration and then to depression. So if you're like fighting a bear all the time, you're producing noradrenaline, epinephrine, you're stressing out, that depletes serotonin and dopamine, and then you crash. There is this sort of like new trend in medicine that we hear that brain fog. I don't believe that's a brain fog. There's no mystery pathogen that's hijacking your brain. Just the fact that you are burnt out, the body will kind of crash you into parasympathetic, and then you become listless and unable to kind of function. So being able to regulate that, is a big deal. Without medication is even better.
Yeah, no, I agree. I think that kind of getting stuck in that fight or flight zone is unfortunately where a lot of people are living their life right now in society in general, right? And how to like activate, go into more of that rest or digest.
Mm-hmm.
That's where some of the things that you were mentioning before, like yoga, meditation, those ways to kind of activate that part of your nervous system. Super powerful.
Yeah.
Yeah. In the case of anxiety, specifically in menopause, you will see patients will show up presenting with hot flashes, night sweats, palpitations, anxiety, insomnia, right? So it disrupts the sleep cycle. So they just kind of trigger and suffer in that sort of spiral. We see this; it's common in Chinese medicine. So instead of like going for psychiatry, getting prescriptive medication, getting a prescription for sleep, getting a prescription or hormone therapy, with acupuncture, we try to get to the root cause, which is the withdrawal of estrogen, and try to balance out the hormones and try to treat all and get all those symptoms under control. Of course, it's a therapy-based medicine. You're going to need a few visits, maybe more, but as long as you're trending and improving, that's just an attainable goal, and it happens really quickly in the case of menopause and hot flashes. In the case of our patients, what we see a lot of is irregular cycles, anywhere from like 25 to 32, all over the place, shifting. That's going to be hard to get pregnant if you don't have like a steady cycle, because day 14 is only for somebody on a 28-day cycle, so they miss it and then they get upset and they feel that they're infertile. That's not the case. We see a lot of cramping, we see a lot of headaches, we see a lot of clotty, sort of like the quality of the blood, and then breath tenderness. That's all a product of like tension, stress, workforce type stuff. It doesn't mean to put somebody on the pill. It means we need to kind of straighten that out, and it is attainable. But these are common patterns we see, and when you start chasing symptoms, you're not fixing anything. You're just kind of being palliative, and that's never where we want to be, at least in our office. The other thing about our office, you mentioned the sense of community. We do try to put together support groups for fertility. As far as an aspect of community within our own clinic, our first patient coming in doesn't believe that it's even an attainable goal, because again, they've been told that they're too old, their eggs bad, they're running out of time. Stress of society demands society. So we try to create an environment, but even within the waiting room, we have an environment. We have people chit-chatting and enjoying the time that they're there, because we want to foster an environment. Regardless of acupuncture, regardless of herbs, regardless of counseling, the most important thing for us is communication. We are taking sort of this foreign medicine and making it more attainable for people, making it more accessible, and that requires a lot of talk, a lot of communication, and a lot of internalizing of what we do here. So it's very important how we communicate with patients.
Yeah, I love that. I love that you have a sense of community over there. And I just wanted to say thank you. We'll definitely be referring our patients over to you, because there are so many layers to improving your mental health. And as people are working through intense trauma, they need to be doing other things. They have to check a bunch of different boxes. It's not just a one thing answer. So is there anything that you want to add about your
No, I mean, I'm really excited for us to kind of like work together and hopefully refer back and forth. I think it's such a valuable resource. Folks having like things that are trapped in their bodies physiologically, and then you working with that chemically and understanding the relationship. I think hearing you say that you're looking to treat the root cause, it's so refreshing, because it's about like patient, and this is kind of an interesting way to like go through that together. So very cool. Thank you.
Takes a village, right?
Takes a village.
All right, thank you.
Thank you, Dr. Bays. I'm going to send out your information and make sure all of our therapists know about you to share with their patients.
Fantastic. Thank you so much. I appreciate the opportunity to share the wealth and knowledge of acupuncture.
Yeah, we really appreciate your time. Thank you.